My name is Magnhild Reiso, and I'm a PhD candidate. And as introduced by Lynn, Norwegian healthcare is under pressure. And for this PhD project, we want to explore the viewpoints of the general public by doing focus group interviews. Back in time, when I was working as a midwife, lack of resources seems to be an exception. Coming to year 2025, circumstances seems a bit different. Resources are scarce and healthcare professionals are experiencing increased workload. Despite this, we have problems with medical overuse. And up until now, the primary target group for reducing medical overuse has been healthcare professionals. And for this PhD project, we want to extend the target group and include all lay citizens, exploring their perspectives and expectations to healthcare. Because one of the drivers of medical overuse is a comprehension that the more the better, also when it comes to health services. Which makes sense. Internet and media are full of articles on health issues and frightening illness like heart disease or bowel cancer or rash leading to serious conditions. And this, of course, may cause worries, giving ideas that checking your health, just to make sure, is a good idea. The doctor, on the other hand, knows that health checkups among people not feeling ill is unlikely to be beneficial. And holding these two different perspectives may cause a lack of mutual understanding and cause frustration for both parts. So to explore the general public's perspectives, our method of choice was to do interviews. So we invited lay citizens in mid-Norway to participate in focus groups. Altogether, we had 7 focus groups with a total of 37 participants. And they came from both urban and rural areas, and they were students, they were senior citizens, they were parents of primary school children, etc. And our next step was to analyze all these interviews, asking ourselves, what are the citizens actually telling us? And together with my supervisors here at the bottom left, one of the things that strikes us is that our common health care is taken for granted. Our participants compares our healthcare system to allemannsretten, which in English refers to the right of public access. This picture is a typical example of allemannsretten, and it's one of the many hiking trails in the mountains of Norway. And these are marked with these red T's, which are accessible to all and they're free of charge. So they used allemannsretten to symbolize healthcare as a collective right, emphasizing core values like accessibility, equality, fairness, regardless of your social or economic status. So healthcare as a common good and not for the profit. And as one participant stated, it's part of our identity and who we are. When discussing how payments or holding private health insurance may provide faster access to healthcare, they became more skeptical. Because payments seem to interfere with the principle of equity, described as unfortunate and unfair. However, though, these ideals of equal access was met by reality, and especially considering long waiting lists. And these causing frustration, impatience, and maybe increased worries while waiting. So when the waiting lists got too long, payments for private services was considered a necessity. And that was clearly a dilemma, because some of them ended up compromising on values and choosing payments for faster access, getting ahead in line as this red guy. As an elderly, quite healthy man though, in his late 80s in one of these focus groups stated, "But I must admit that if the doctor says it'll take a very long time before I can do something, then I pay for it. I pay. It goes against my political beliefs because I'm contradicting everything I believe myself, you know. So the red flag that I usually carry, I lower it, and then I sneak and pay 15,000 kroner to get something done within a week. Another aspect we noticed in our data was the participants' lack of knowledge and understanding of how the system actually works. Typically, they asked us why, or how, or reacting with what, and leading to what we choose to call journeys of insight. For instance, they asked us about how public and private health services are organized. For example, what about private services? Don't they simply just lift the pressure off the public system? Is it the same doctor in both systems? Are we waiting for the same MRI machine? And what about private health insurance? How does that work? What? Does it mean cutting in line? So asking questions and during these collective reflections, their understanding and awareness increased, and realizing the complexity of the system and what might be at stake. Another thing we noticed is that to cope with the waiting list or to trust decisions made, they demanded to feel safeguarded. And safeguarding, as in Norwegian refers to ivaretagelse, was the key to moderation. It was a matter of feeling taken care of. So they needed someone to hear them out, explaining them why, based on their individual needs. And the relationship with their GP, as in Norwegian fastlege, was considered as a hate-love relationship. Only a GP who knows me can stop me. So building trust was essential. And this way, they somehow also actually could appreciate a well-considered no from their GP. As a woman in her 40s put it, I have chosen a somewhat ordinary GP just because I need someone who is a bit determined. So I don't like her at all, but I've been going there for 10 years. I want a bit of resistance. So for the road ahead of us, we find it encouraging to see how our participants showed interest to understand the system and how they engaged. And our impression is that the participants wanted to keep healthcare as a common good. So the project so far has made us realize that a well-functioning healthcare is taken for granted. They had limited knowledge about how the healthcare system actually works and went through these aha moments or journeys of insight. And feeling cared for, as in safeguarding, seems crucial for moderation related to medical overuse. Thank you for your attention.